Good morning, ma'am. Good morning, classmates. Now I'm going to report about Ascariasis. But before we start or before we proceed on my report, let's first have an icebreaker. Tatlo lang po itong pictures na huhulaan nyo lang kung anong letters ang nawawala para makabuo ng word. So, ito po yung una. Pangalawa, at ito po yung last na. So, let's proceed na po sa aking report. What is Ascariasis? Ascariasis is infection of the small intestine caused by Ascaris lubricoides, the largest intestinal nematodes to infect human. So, Ascariasis po is a parasitic infection of the small intestine caused by the roundworm Ascaris lubricoides. Ascaris lubricoides po is the largest intestinal nematodes to infect humans, reaching lengths up to 35 centimeters. This infection is prevalent in regions with poor sanitation and hygiene practices, particularly in areas with inadequate sewage disposal and contaminated water sources. So, para naman po sa mode of transmission, Ascariasis spreads primarily through the fecal-oral route, typically occurring when individuals ingest food, water, or soil contaminated with Ascaris lubricoides eggs. This contamination often happens due to poor sanitation practices, where human feces containing the eggs contaminate water sources or are used as fertilizer for crops. Consequently, consuming raw or undercooked vegetables or drinking contaminated water can introduce the parasites into the human body. And for the pathogenesis naman po, we have two phase in Ascariasis. The first phase is the migrating larvae phase. As the ingested eggs hatch in the small intestine, the larvae penetrate the intestinal wall and migrate through the bloodstreams to the lungs. This migration phase can lead to pathological lesions, the severity of which depends on various factors, including the host immune response, nutritional status, and the number of migrating larvae. During their journey through the lungs, larvae may induce pneumonia-like symptoms such as coughing, wheezing, and fever, as well as allergic reactions. And ang pangalawang phase naman po is the adult worm. The adult worm phase. Upon reaching the lungs, the larvae are coughed up, swallowed, and returned to the small intestine where they mature into adult worms. These adult worms can cause a range of symptoms including abdominal pain, blockage of the appendix or bile duct, and malnutrition, particularly in children. The metabolic byproducts of the worms can trigger immune responses and allergic reactions, leading to symptoms such as fever, conjunctivitis, and skin irritation. And for the clinical manifestation, we have two, the intestinal ascariasis and the pulmonary ascariasis. So for the intestinal ascariasis, the symptoms of intestinal ascariasis includes nausea, vomiting, colicky, abdominal pain, distension, weight loss, and diarrhea. In severe cases, heavy worm burdens can lead to intestinal obstruction, appendicitis, or biliary colic. Malabsorption of nutrients can result in growth retardation and developmental issues in children. And for the pulmonary ascariasis naman po, during the larval migration phase through the lungs. Pulmonary symptoms such as transient eosinophilic pneumonitis or the Leffler's disease, bronchospasms, dyspnea, wheezing, fever, non-productive cough, and chest pain may occur. Elevated levels of immunoglobulin E are often observed due to the allergic responses. And for the diagnosis po, diagnosis of Ascariasis involves various methods, including microscopic examination of stool samples to detect eggs or larvae, serological tests to detect specific antibodies in blood serum, and imaging techniques such as ultrasounds or X-ray to visualize adult worms in affected organs. In some cases, endoscopy or surgery may be required to directly visualize and remove adult worms. And now for the treatment, anthelmintic medications like albendazole, mebendazole, or the pyrantelpamoate are commonly used to eliminate the worms. Severe cases or complications may necessitate additional interventions. Follow-up stool examination are often recommended to ensure complete eradication of the parasites. The last one is the prevention. Preventive measures include promoting good hygiene practices such as hand washing and proper disposal of human waste, avoiding consumption of contaminated food and water, educating communities on sanitation practices, and implementing regular deworming programs in high-risk areas, especially among children. And that's all for my report. Thank you. Now that I am already done with my report, let's proceed on my quiz. Ito naman po is, tawag dito. Ito naman po is multiple choice lang, kaya alam ko naman pong madali ito para sa inyo. So, number 1, what is the primary mode of transmission of Ascariasis? So, A, airborne transmissions, B, direct contact with infected individuals, C, fecal oral route, or D, vector-borne transmission. So, for the number 2, which parasite causes Ascariasis? A, tapeworm, B, roundworm, C, hookworm, D, flock. Number 3, what is the largest intestinal nematodes to infect humans? A, hookworm, B, tapeworm, C, Ascaris lubricoides, D, whipworm. During which phase of Ascariasis do migrating larvae cause pathological lesions? A, adult worm phase, B, egg-laying phase, C, migrating larvae phase, or D, cyst formation phase. Number 5, which of the following symptoms is not commonly associated with intestinal Ascariasis? A, nausea, B, vomiting, C, chest pain, D, abdominal distension. Number 6, what pulmonary symptoms can occur during the migration of larvae through the lungs? A, pneumonia, B, asthma, C, bronchitis, D, all of the above. Number 7, how is Ascariasis diagnosed? A, blood test, B, chest x-ray, C, microscopic examination of stool samples, D, urine test. Number 8, which medication is commonly used to treat Ascariasis? A, antibiotics, B, antifungal, C, anthelmintic drugs, or D, antivirals. For number 9, what preventive measure is effective in reducing the risk of Ascariasis? A. Vaccination. B. Hand washing. C. Mosquito netting. D. Sunscreen application. Number 10. In which population group is Ascariasis is most common? A. Older adults. B. Pregnant women. C. Children in developing countries. Or D. Healthcare workers. And that's all. Thank you.